The mayor of Stamford says 80 hospitals in the past 10 years in rural areas have closed in the United States, one being in their own town last July. Now being a health center with a full-service health clinic, KRBC's Kelsey Pittman goes in depth about what city leaders are doing to look for the future of Stamford's health services for tonight's top story.
Rural healthcare, something Stamford Mayor James Decker says has been a long-time issue.
Well, it matters. You know, our informal Stamford Healthcare Committee here is made up of just kind of a different group of leaders in the community that it matters to them. We've all got investments in the community.
8 months after Stamford redesigned their local hospital, adding new services but losing their emergency room, Jen Aston, one of the committee members, now looking at new means.
Search out all means and any avenues that could or would or do exist to return some sort of 24-hour 7-day-a-week health care here, hopefully even some way to do an emergency room.
With the future unknown,
Advanced cases are going to go to Abilene, Lubbock, wherever, but that emergency care is what really hits home with people and what really bothers people.
looking at surrounding communities for ideas.
I'm going to be visiting with area hospitals, districts, looking at the models that they have. See if there's some ideas that we can pick up from there. Certainly working with the Torch, Texas Organization of Rural and Community Hospitals.
Determined to find a solution.
Right now, I don't have all the information to tell you. I can tell you this, I'm going to find out.
In Stamford, Kelsey Pittman, KRBC, Abilene's local news.
All right, thanks, Kelsey. Hospital officials will hold a town hall meeting Thursday at 6:30 p.m. That's located at the VIP Center to have an open discussion with the community about the future of health services in Stamford, answering any of those questions that you might have.